Dear ladies and gentlemen, greetings from Frankfurt. I'm Natalia Korchikova-Hip, founder of PPPHealth4All, a global award-winning platform for facilitation public-private partnerships in the healthcare sector. And today, topic of our discussion is how digital health solutions are helping to achieve Sustainable Development Goal number 3, and in particular, universal health coverage. And I'm very happy and privileged to welcome our guest today, PPPHealth4All Persona, Samir Pujari, who is acting head of the unit in the World Health Organization departments on digital health solutions and innovations. Dear Samir, first of all, very much thank you for being with us today. And we're looking forward to hear from you what is your department is doing and how it contributes to promoting digital health solutions.
Thank you so much, Natalia. Thanks for having me here. And thanks for this great forum to spread the word around digital health. WHO, as you know, is a specialized agency of the UN for health services, and digital health has come up more than ever as a key area of enabling healthcare services for countries. We've seen this in light of COVID more so than ever before, that digital health is acting as an enabler to push not only the SDG 3 agenda, but also the global program of work for WHO with its target of 3 billion people. And there are several areas of work that they're focusing. But let me start off by mentioning what our DG, our Director General of Tedros, always says, that today's digital health is tomorrow's health. So we have to prepare ourselves from that perspective. We have seen this already in the banking world. We don't anymore call it digital banking, we call it banking. It's normalized as all of the world. So in the same way, WHO, together with all its member states, has resolved to creating digital health as an enabling environment. And we have already worked towards a global strategy of digital health, which was endorsed by member states last year during the World Assembly.
Well, thank you very much. You touch interesting topics, and I'm very interested to know how actually WHO and governments working with the private sector, how they collaborate.
Thanks, Natalia. That's a very, very important point and question. And the word digital health itself implies there is a combination and collaboration between digital and health. So you have to come together. Now, having said that, as I mentioned just before, the global strategy on digital health, there are 4 key strategic objectives that WHO and all its member states, the 194 member states that we have together agreed on. There are 4 objectives. The first objective is around global collaboration and knowledge sharing. The other areas include on scaling up implementation, on strengthening governance, and on taking people-centered care. The first point, as you mentioned, about the collaboration is very crucial. Digital health, the knowledge is growing in the technology world, it's growing in the private sector, in the public sector. And so we want to bring that together through collaboration. And digital health success depends heavily on how this is deployed. An example of this is WHO, together with the International Telecommunications Union, the ITU, has been jointly working on an initiative called as mHealth Mobile, which brings together knowledge, the expertise, the leverage from the private sector, whether it's technology firms, whether it's the startups, whether it's AI, and then using that through a proper screening mechanism and a filtering process, helping countries scale up these programs. So I think that's how we are working closely with private sector to bring the knowledge together, the experience together, and scaling up and helping governments implement these programs at the country level. Again, in terms of collaborations in COVID, the other example was we had over 80 different projects where we partnered with private sector to deploy requirement services, whether it's collecting data and displaying dashboards, whether it's doing real-time analytics. There's several areas of work where we're collaborating closely with the private sector to make sure that we can leverage the best values and filtering out any biases or any risks associated.
Well, thank you for elaborating on collaboration with the private sector. As we know, there are various types of collaborations, various types of partnerships. Do you have by chance any example of public-private partnerships which were implemented in the digital health areas, and maybe any successful cases that you could name?
Absolutely. Just building on the program, as I mentioned, on the Be Healthy Mobile initiative is one of the examples. Another big area of work that we're working with ITU and the whole sector of private sector companies is the AI for Health focus group. AI is a new area of digital health. It's upcoming. There's a lot of evidence growing. Recently, we saw in the publication in the PubMed where there was research showing that the evidence from image-based AI programs is growing rapidly. And we want to scale that up to make a maximum impact. So WHO, together with ITU, and as part of the AI for Good program, we have set up a focus group called AI for Health Focus Group, which is creating benchmarking for how AI can be deployed and successfully managed at the country level. This also looks at how we can create a mechanism of data sharing. One of the big areas for AI is having data to validate these algorithms. So we're working with ITU and all the huge private sector partners there, including academics, but including technology companies, including startup companies, including data companies, health companies, all coming in together to make that valuable contribution. So that's an important example of PPP. Another quick example is the collaboration on the safe listening module. Technology is growing, and WHO together with all the tech companies, mobile manufacturers, Apple, Samsung, have come up with standards, and ITU, of course, on how to manage these hearing levels so that we avoid, we keep safe listening as a priority and avoid the hearing loss for patients. And this has been deployed and employed. All the new devices are actually incorporating those standards for health. So there are very good examples where together we can deliver strong, quick digital health impact on the ground.
Well, thank you very much. You also mentioned the artificial intelligence, right? The AI, and it's very important if we talk about sustainability, to tackle the issues of digital inclusion and gender inclusion, and how these issues are tackled by World Health Organization.
Very, very important point. And the gender equity is the core of SDGs, it's core of discussions at WHO. And it's an important priority, and equity in general, equality and equity across the platform. Going back to the global strategy on digital health, this is a core consideration across the strategy. Every initiative we are implementing, we are considering how equity is addressed in this place. Again, quoting our Director General, leave no one behind in the digital era, is what we're trying to look at. Even going to the bottom of the pyramid, all the population who are remote, distant, how can we benefit them? So making sure that special populations are addressed, gender equality is addressed. So the strategy ensures that, and again, with member states, there has been a huge focus on how equality and equity is addressed in every initiative that's happening. We are doing special capacity building courses around this, but also ensuring that we are deploying these programs. And there's a lot of potential. I mean, one of the big programs that we are working on is cervical cancer using AI algorithms. We're trying to reduce the cost of screening cervical cancer patients in remote Africa, which is very high at this stage. And AI has that potential to reduce that cost and deploy. So just an example of how more and more technology can be inserted and ensure that we can have the equality and address the maximum population.
Thanks a lot. This is very important because PPP Health for All is also very keen on sustainability, and I think to design digital health solutions which taking into consideration the digital inclusion, age inclusion, gender inclusion is very, very important. So we know that WHO also supports European mHealth Hub. and we had the pleasure of having your colleague Violetta speaking for the German Health Hub recently. So maybe you say a couple of words in this regard, which is the involvement of WHO in this initiative, and maybe we would be also interested to know what are recent resources, reports were released by WHO recently, so we could share with our stakeholders this information.
Absolutely, thanks. Let me start off first on the hub specifically and the discussions around the hub. To tell you a historical story is when we started the Be Healthy, Be Mobile initiative, we got a lot of demand from countries to implement programs and support programs. And we were overwhelmed with this opportunity. So I had the opportunity to meet the former Director General of DG Connect, Dr. Madeline at that stage. And I discussed with him this concept, and it came out that we need to jointly work together on implementing this potential of digital health and preparing ourselves for the next world. And also to avoid this verticality. There's so much, as you mentioned, the first point about collaboration. There's so much happening when we bring all those people together. So together with ITU, WHO, and the European Commission, we ventured out to create this model of a digital health knowledge hub to help member states and countries use the knowledge, use the leverage of the different sort of segments, PPP models, and then help them rapidly implement and adopt digital health solutions. So that is how this concept of the hub was established. It was an open call, and when we set up this hub, I was humbled to see that all the top digital health agencies in Europe applied for this hub. And the final hub that was selected was a consortium of 18 top digital health sort of entities in the region who are now working very closely on all dimensions, creating knowledge products, helping countries implement digital health programs, and focus more on mobile health areas as well, helping on policy development, helping understand the landscaping pieces. So there's a lot of potential work that's happening through this hub. And this is the first step. We want to create and replicate these kind of hubs to ensure collaboration across the globe. And we're already in discussions to create a network of networks, if you may, within WHO. This is also a good way of leveraging WHO products, as you mentioned, that have been generated. And WHO has been recently producing a lot of these products. We have, as I mentioned, the Global Strategy on Digital Health, which is a key document which has 172 actions for WHO, but also for its member states and for partners, which include all this private sector and public sector sort of entities to help and engage themselves in the digital health era. We have released a clearinghouse document, a clearinghouse process where eventually we'll help countries see the best products that are coming out. We have released ethical guidance, two important documents. One is the investment guide, digital implementation investment guide that has come out from WHO, which helps countries understand and plan the investments for digital health, and a technical document on digital health platforms, how these can be deployed. There are several other resources in terms of health topics, whether it's for diabetes, hypertension, how can we take WHO guidelines and convert that into digital health. And I encourage people who are interested to look at the WHO digital health website, which I hope can be shared to this thing also, to look at these resources.
Thank you very much for sharing your insights and talking about global networks and resources and sharing, which I think we are doing at PPP Health4All. What you would wish us as a platform, as a global platform?
Yeah, thank you. And I just want to say to everyone that let's join hands together and collaborate in making digital health a reality. It's more needed than ever. And I think it's the strength of digital health is again in collaborating and bringing together through platforms like these, which can deploy and help countries and may take health to the population level where it's needed. So looking forward to collaborate. Happy to join hands with anyone. Thank you.
Thank you very much. Thank you for being with us. And we would like to wish you and your colleagues a lot of success and very important work that you are doing. Thanks again.
Thank you again for having me.